Hey, I'm Sasan Kasravi with Proteus Debate Academy. We are a YouTube channel that makes free content to help you get better at debate, whether you're a coach or a competitor, or whatever format of debate you're doing, as long as we can help. So let us know what you'd like to see, whether it's a different round analysis or just a topic you'd like to see covered. We have lectures, we have interviews, we have discussions, we have rants, we have feelings, we have thoughts. We got it all. Let's go to our debate wheel of pain and pick a round to do a analysis on. An analysis, I suppose, would be more proper. Okay, we got this. So I actually just started. I did this. There was a link here. I'll bring it back. I just did this for made 6 minutes of a video, and it landed on this one, and it was requested before I did the 2018 analysis, which is on the channel, and it is the 2018 round. So I can't tell whether the link was sent incorrectly or whether when there was a request they had a typo and they wanted the 2018 one, which I then later did an analysis of. So I guess we'll highlight this one like yellow. Nope, not the just in the. So I don't know. I'll figure that out later. But for now, let's get another round going. So random number between 1 and 50, and technically 30. Okay, I was going to say technically there is no 1 on this list. I guess if it lands on 1. Okay, we already did that. So let's do another one. 21. 21. We got milkshakes, man. Requesting Edina MZ versus Lakeville GN with the rationale that the case read by the neg is really cool and the round has good meta weighing as well. Public forum debaters use the term meta weighing a lot, and is it just weighing? Is it weighing but not because of the argument's probability, but because of the quality of the argument? I don't know, but I suppose let's find out. So hopefully if we come over here and go to YouTube and we pop that into the search bar, I'm going to assume this is the round in question because I don't see any other rounds that contain both of these two teams popping up. Okay, cool. So this is
all right.
A pretty my understanding is that this is a bid tournament, so I imagine this is going to be kind of on the more TOC track, technical, maybe a little fast. I don't know. Let's find out. When is Yale, and what was the topic? Is this going to spoil the result? Okay. Maybe they're going to say it at the start, or maybe I'll just remember. Okay, well, I'm excited. Let's get started.
Then I'll begin. Lakeville affirms in our first contention is preventative care. U.S. preventative care is terrible, with layman 18 finding survey data found only 8% were getting recommended preventative services, including screening for cancers, counseling on obesity, and vaccinations.
Okay.
This is because private insurers rely on short-term profit.
I think this is a topic that I actually do know a bit about, but let's find out exactly what the topic was. Preventative care is a good argument in general, but we want to know what the exact resolution is because there's nuances that matter. All right. 2020, I'm guessing 2020, right? 7 months ago. So, Medicare for All 2019 is almost certainly. Yep. Okay. Medicare for All Act of 2019, which there were two Medicare for All Acts of 2019, which is a nuance that may or may not matter in this round. All right. Let's get to it.
18 findings, survey data found only 8% were getting recommended preventative services, including screening for cancers, counseling on obesity, and vaccinations. This is because private insurers rely on short-term profits, with Levi 19 explaining underutilization of preventative services is a result of an implementation gap rather than an information gap. Financial incentives do not align with a focus on preventing chronic diseases. Providers are paid to treat rather than to prevent disease. The AF solves as Tannenbaum 19 explains, only governments have the wherewithal to invest in people as productive and tax-paying members of society over their lifetimes. Medicare for All may be the only solution for the short-termism of employer-based healthcare. The impact is health, with Kelly 16 predicting 100,000 lives to be saved.
That's a pretty solid argument. What the argument seems to be saying is that when you receive healthcare, people make money off of that. Particularly, let's say, pharmaceutical companies. So a pharmaceutical company isn't necessarily financially incentivized to prevent you from getting sick, because only by you getting sick do you need to buy their medicine. That's pretty solid, but I don't know how that shakes out with insurance companies, because insurance companies only make money when you don't get sick or when they don't pay for your care. So that might be something to think about there. Let's see what the next argument is. I don't know why the spacebar just decides not to work.
Employer-based healthcare. The impact is health, with Kelly 16 predicting 100,000 lives to be saved each year with widespread adoption of preventative healthcare. Our second contention is global access.
Yeah. Preventative care is a pretty open and shut reason to pass Medicare for All or some sort of better public healthcare option. I think, like, okay, there's some question as to whether other groups are, like in the status quo, are incentivized to have political or to have preventative care. But at the end of the day, like, they're just not effective at it, right? Even if everyone that had healthcare was receiving proper preventative care, which the evidence just shows they're not, it's going to be really hard to argue that the uninsured becoming insured is not going to increase the propensity for preventative care to happen. And preventative care saves lots and lots of lives. So yeah, this is a really solid argument. It has great impacts, really clear and strong links. So I think it's definitely an argument that I would have gone for if I was on the pro-Medicare side. I'll talk a little bit more about what I want to hear, or at least what you should be thinking about in terms of the negative when we get there.
Prices in the developing world are kept extremely high, with Neville 19 finding the world's poorest countries are paying the highest drug prices, with everyday medicines costing up to 30 times more than in rich nations. Markets tend to be dominated by a single supplier, directly affecting the prices paid by public bodies or consumers. Medicare for All would solve in two ways, and the first is reimportation. Fears of drug importation keep prices high in the developing world, with Commander 11 finding manufacturers are reluctant to lower prices in less developed countries because those products can be resold to more developed countries where they were manufactured, undercutting the prices charged there. Medicare for All solves by decreasing drug prices here in the United States, taking out any need to import drugs, and thus allowing companies to lower prices. As CATS 19 finds, patients in the United States pay the highest prices in the world for prescription drugs.
Whoa, okay, I don't like that, right? Let's go back. There's an important solvency claim here, right? There's a real issue going on in the status quo, and let's get to the solvency claim here.
For developed countries where they were manufactured, undercutting the prices charged there.
Here it is.
Medicare for All solves by decreasing drug prices here in the United States, taking out any need to import drugs, and thus allowing companies to lower prices. So
the solvency argument is, okay, then we make the drug crisis here, or I guess the medicine crisis here, better. So there's no need to import drugs because people won't be sick. And then companies won't have to worry about people importing cheap drugs from other countries because they won't need to. This seems like a pretty suspect link. It assumes a lot of weird decisions from like drug companies where they'll be like, oh, well, I guess if there's not a lot of demand, then, oh, what's the harm? Which doesn't sound like the evil corporations that these corporations are. So I would love to hear evidence here. But I think the evidence that we're about to hear isn't speaking to the claim we just heard. Let's hear it.
Cas-19 finds patients in the United States pay the highest prices in the world for prescription drugs. A Medicare for All system would have more leverage with the drug industry and would reduce drug spending by a third.
So you don't have actual evidence that says if Medicare for All passes, one, that people won't be sick in the United States and won't need the medicine, or two, that in the event that people don't need the medicine as much, drug companies will then find no reason not to make drugs cheaper in other places. Like, they won't want the profits from other countries. I don't know. I don't like that argument. Compared to the preventable care one, it's just the links are much less. It just seems like something a debater made up. Maybe it's not, but it's on you to show me that with warranted evidence.
This is crucial, as the threat of reimportation is the primary reason for high prices in the developing world, with Danzanon 03 concluding, manufacturers' ability to maintain price differentials is the single most important obstacle to lower prices in low-income countries.
So the logic here is that, like, the biggest reason that the costs aren't lowered is because they could import it to the United States. So the logic is X leads to Y. The potential for importing to the United States, X, leads to Y. Them not reducing the high costs internationally. And the logic is, okay, let's not do X. Let's get rid of X. Therefore, Y won't happen. And this is a logical fallacy that I talk a lot about on this channel called denying the antecedent, where you're saying X leads to Y, we don't do X, therefore Y won't happen. The problem there is you need to show that only X leads to Y, that there's no other scenario in which Y happens. So the example that I learned this with was the show Dexter was still on TV at that time, with the serial killer, not with Dexter's Lab. If Dexter leaves fingerprints at the crime scene, he will get caught. Dexter did not leave fingerprints at the crime scene, therefore he will not get caught. And that is a logical fallacy because there's hundreds of other ways that Dexter can get caught. There can be witnesses, there could be hair or footprints or a confession or anything, right? And I understand this debater's point. Look, it is the biggest reason why this happens, so don't you think it would be likely that without it, it won't happen anymore? Well, if I'm the other side, my answer is absolutely not, and you have no evidence saying it is, right? So we need positive evidence instead of negative evidence. Like negative be in the sense of, or like at least positive warrants, right? So what I mean by that is like you want a source that says doing your advocacy causes the impact, right? But what you have here is a card saying doing the status quo causes this, and the negative aspect of it is you're saying by departing from the status quo, we also like no longer have that and therefore gain some impacts from the lack of doing something. And it's not strong because you don't have an evidence for the link between those things. Now, if an argument is conceded, it's good enough. But if I am the negative side, I am definitely going to try to harp on that as much as possible in cross-examination. One, not only to diminish the chances for the affirmative to go for this second contention, but two, try to make them look as bad as possible and discredit them and kind of put them on like uncomfortable footing throughout cross-ex so that they can't ask me any tough questions, really. Let's see what else is going on here.
Second, evergreening. Currently, drug companies hold on to monopolies around the world by renewing useless drugs. As Narayana 19 explains, 90% of new drugs provide few or no clinical advantages. A technique known as evergreening is when drug companies produce minor modifications of old drugs. By making slight alterations, companies continue to hold patents for drugs to prevent competitors from selling generic versions. Medicare for All solves by refusing to pay for replicated drugs. As Narayana continues, if a new drug had more benefits than an older version, the government would pay more for it. If a new drug produced the same results, the government wouldn't pay more for the new drug. So Medicare for All would encourage pharmaceutical companies to pursue truly innovative drugs because such drugs would be more profitable instead of producing redundant medications. A lack of generics
what's the link again?
Pay for drug companies produce minor modifications of old drugs. By making slight alterations, companies continue to hold patents for drugs to prevent competitors from selling generic versions.
What I don't understand, and I'm not saying this is a problem with the argument. What I'm saying is that what I actually don't understand is if the argument is that there's no difference between drug A and drug B, and the only reason they made drug B is to have a new patent for drug B, then what prevents you from making a generic version of drug A, which in your own words is the same as drug B? That's something I'm not following there. But again, maybe there's a clearer and like better link here. Maybe there's a specific Medicare for All policy plank that does something to prevent this from happening. But the way I heard it was that, again, this is like this would incentivize companies because of profits and whatever to not make new drugs to maintain patents that are the same. They would only seek new drugs that are better and therefore kind of circumvent this problem. Not really solve it, but like circumvent the problem by no longer making it appealing for companies to engage in this immoral activity. That's what we would call a perception link, right? Like you are anticipating what the perception of these companies is going to be, in the sense that you are saying they're going to be motivated to do this, and therefore that's how they will act. Your evidence is always weaker when you are presuming how an outside entity would make a choice. But additionally, it would be really great if you had actual evidence for this claim here, where someone who's credible says, like, if this was true, right? This one might be, right? But if it was true that Medicare for All passing would prevent an immoral drug company practice, then it wouldn't be only debaters talking about this and reading about it and knowing about it, right? If this is a real immoral thing that is happening and Medicare for All will actually prevent it, then I would expect a lot of pundits in favor of Medicare for All or public health care to have identified and spoken about this issue, and it'd be pretty easy for you to pick one to cite. If you don't have that, I have to assume that you couldn't find it, and then I have to assume it's because your link is actually not that likely. Now, maybe I don't make my judging decision exactly that way, but that's certainly the perception that it's creating in my mind. And that's important, because going into the next speech, when I'm hearing responses, subconsciously I'm going to be looking for reasons to vote for the preventative care argument because I like that argument. I think it's true. So my brain is going to be hearing criticisms of that argument and trying to identify what's wrong with the criticism. Whereas with the other arguments, and I don't like them, I'm going to hear criticism and I'm going to be like, great, there's good enough criticism that I can now not vote for this argument I don't believe. Even if the criticism might not actually be the reason I don't believe the argument. And even if it doesn't actually quite make sense, you can't prevent a judge from voting down an argument they dislike when they have what seems like a good excuse to vote it down. So your only options are to give them no possible excuse when you know they're not going to like the argument, and that requires you to be very good at debate, very fast, very detail-oriented, have great round vision, have great flow, communicate all of that to a very technically proficient judge, or to just go for arguments that you don't think the judge will dislike or distrust. Let's see here whether there's any direct evidence in support of what we just heard.
Medicare for All solves by refusing to pay for replicated drugs. As Narayanan continues, if a new drug had more benefits than an older version, the government would pay more for it. If a new drug produced the same results...
So it says here that Medicare for All refuses to pay for replicated drugs, but they're not citing where in the policy, like what does that policy actually say? Because it sounds here like you're citing a pundit talking about how replicated drugs aren't useful, or that basically, hey, these are new drugs, but they're not better. But what I'd like to know is what mechanism in Medicare for All actually prevents these from happening as a matter of law, which seems to be the link you're claiming here.
Government wouldn't pay more for the new drug, so Medicare for All would encourage pharmaceutical companies to pursue truly innovative drugs because such drugs would be more profitable instead of producing redundant medications. A lack of generics make prices impossible for the developing world where patent regulations are less stringent. With Grant 19 finding a robust market for generic drugs is a core part of an affordable health system, there is little competition in the supply of essential medicines in low-income countries. The largest seller can account for upwards of 85% of all sales. The impact is mortality, with RCP in 2019 finding 2 billion people worldwide have no access to essential medicines and vaccines. The death toll is estimated at 10 million people a year. Our third contention is a factory...
Again, that's kind of like you don't have a source saying Medicare for All gets medicine in these places. You're just saying there's a lack of competition. You're saying whatever. There's a lot of, denying the antecedent here, which you see a lot in technical debate. And it's not because it's an advanced way of thinking. It's just I want to say squirrely, but it's probably like done in good faith, right? I don't want to imply that these debaters know that this is a questionable argument and are trying to get it by anyway. But I certainly think that it happens more in like more techie debates because the advocacy you're going for, the arguments you're trying to make, isn't actually that substantiated and isn't that much written about in the topical literature because it's not actually likely to happen.
Farm pandemic. The next great pandemic will emerge from U.S. poultry farms, with Heidi 20 writing factory farms are the perfect...
That's hilarious. Pandemic, great argument. U.S. poultry farms, probably the next one. But yeah, this will be a trip to hear about the pandemic, pre-pandemic.
Breeding grounds for disease.
Well, pre-pandemic? No, this was a pandemic. I mean, look at them. They're online. Okay, so this is post-COVID, and you're just saying the next one will be from U.S. poultry farms. Fair. I don't know why my brain, for whatever reason, thought. Pandemic's been a lot longer than I realized, I guess.
These operations house tens of thousands of animals in overcrowded, poorly ventilated, and unsanitary conditions. Strains of bird flu that have infected people have already resulted in a mortality rate as high as 60%. The World Health Organization has said that a future pandemic from the bird flu is a certainty. Medicare for All would lead to a stronger response to new diseases by centralizing healthcare, with Zimmer 20 finding Medicare for All would implement a standard billing and payment system which would accelerate case reporting. But then...
stronger than the fastest any vaccine has ever been developed. I don't know. I think the status quo solves there. I don't know that pandemic is necessarily the route to go, because I also don't know, like, I mean, it's maybe there's other mechanisms, but I don't know. If anything, this year has kind of disillusioned a lot of Americans with how reactive our political system can be to actual crises. Yeah, so I don't know. Let's hear the evidence for why Medicare for All makes us able to produce medicine specifically in response to a pandemic more quickly than the status quo, which has already done it in record time.
As high as 60%. The World Health Organization has said that a future pandemic from the bird flu is a certainty. Medicare for All would lead to a stronger response to new diseases by centralizing healthcare. With Zimmer 20 finding, Medicare for All would implement a standard billing and payment system which would accelerate case reporting.
Okay, so you're accelerating case reporting because more, not even because more people go to the medicine, but because there's a standard billing system? Like, is the billing system in the United States the reason why, like, they're like, if it wasn't for that billing system, we would have had this whole pandemic licked?
In a consolidated system, patterns in billing data can signal outbreak hotspots to public health officials. The single-payer system in Taiwan has facilitated exhaustive data collection and reporting.
We tracked hotspots pretty well. I mean, I would need a link between tracking hotspots and then being able to do something about that without a Medicare for All actually changing any policies that allows people to, like, mandate quarantines or vaccines or something like that, right? Because I'm pretty sure you're going to get some really big impacts out of, like, an extinction or whatever, right? But, like, I don't see how tracking it gets us any closer. Maybe it's a try or die type argument, but I don't know. You need some actual evidence. And does your evidence do you have any cards that say Medicare for All will prevent the next pandemic? Because so far you've just talked about how it will improve centralized healthcare by having a billing system. But that card, which I would call for, I'm confident doesn't say, like, which will then solve the next pandemic or a pandemic or lead to new vaccines for the bird flu. Okay.
Taiwan empirically proves the system works, with Williams 20 finding the island has had just 7 coronavirus deaths. Taiwan had a universal healthcare system that keeps records on every resident to make tracing infections much easier. The impact is
Yes, but they also, whatever. We all know these arguments, right? But I think that's fine. I think there's more to be said there. I think certainly got a little gnat and it's driving me crazy. Whatever. I'll let it go. I'm an adult. Right. Yeah. Okay.
Preventing another global pandemic, with Pomaro 20 predicting COVID-19 could push 100 million people into extreme poverty, with long-lasting impacts concentrated in countries that are already struggling with high poverty rates. Coronavirus is only the tip of the iceberg, with Mandel 20 predicting COVID could be considered a Category 2 in the scale of pandemics and a more deadly pandemic, perhaps 100 times worse when it comes to produce a fatality rate of 1 in 2, thus we affirm.
Right, so you're taking that super weak link and then you're getting the impact of something 100 times worse than COVID. So all in all, pretty good debater, pretty good case. I like the preventable care argument. I feel that it's going to be lost. And I don't mean lost as in the opposite of won. I mean lost as in the opposite of found. I think there's too many arguments here. I think the negative is going to attack a lot of those arguments, and they're going to be, like, pretty credible attacks, hopefully. And what we're then going to see is the affirmative try to defend against all of that, so they're going to end up having to talk a lot about the second, third, fourth arguments in the round. And as a result of that, I feel that they're going to have a harder time, like, collapsing to preventable care. Or they're just going to have a harder time coming out, like, with the perception that they're winning the round. Even if they are winning that preventative care argument. I feel like I keep wanting to, or perhaps accidentally calling it preventable care, which is not. It's not the same thing. All right, let's see what's going on with the negative here. So, what does the negative want to do? Well, generally speaking, this is a rough topic to be on the negative of. Especially when you're not allowed to run a counter plan. So we put out a video on counter plans. If you're curious, you can go listen to me talk about counter plans for an hour. But in that video, I talk about when we run counter plans, which is when we can't defend the status quo. There are like 3 examples that I use to explain, like, situations that just the status quo is straight up indefensible. And you're never going to win a debate defending the status quo. The first is, like, the war on drugs, or like any sort of drug policy. Addiction is rampant. I think a recent survey said like 86% of Americans consider the war on drugs to be an abject failure. Maybe it was in the 70s. Where you're just going to have a hard time winning, like, things are going well. The other one is healthcare. Like, it's just not going well. Like, changing nothing is not what anyone in the political system is advocating for. That's what sucks about having to defend the status quo in public forum. Even Trump was trying to change. He wasn't like, the right was saying, don't get rid of Obamacare unless you're replacing it with something. So no side of the aisle is completely satisfied with how things are going or want, just the status quo. It's a question of which change is most optimal. Third situation is probably like prison reform, right? Or like environment, right? These are topics where it is just really difficult to make someone feel enthusiastic about how things are going. So what does the negative want to do? Well, if I was them, I would definitely want to defend something that is not the status quo. They can't advocate for a counter plan, but the NSDA defines a counter plan as a, like, specific implementation of an advocacy. It says specifically that they are allowed to defend, I forget the exact words that they use, but, like, basically overall strategies. Like, just let's find the exact, because here's where it's going to come up. Hopefully they, NSDA High School Unified Manual. Hopefully they're not just going to defend the status quo. But let's see. Here's the rule book. Scroll down, find public forum under the rules. There it is. Whereas plans, counterplans, and it says clearly they should offer reasoning to support a position of advocacy. Debaters may offer generalized practical solutions. That is the term that I'm looking for. Generalized practical solutions. So to me, that means if the topic is universal basic income and you want to advocate for nearly universal basic income, you're allowed to. You're not saying exactly how, when that will be implemented or any details any more than the affirmative is saying how universal basic income will be implemented. And nothing in the rules says that the negative needs to defend the status quo. And if you would say, well, in debate theory, negative generally does, that only applies when the affirmative is using fiat to change the status quo by implementing what a policy resolution says. In public forum debate, the negative can go first, the affirmative can go first. It's based off of the show Crossfire, right? They just generally represent what these sides of this issue have to say. And if I'm the negative, I am absolutely going to advocate for some change in the medical care system that is not Medicare for all. So maybe it's Joe Biden's like Medicare for all who want it, or I don't remember who said that, or like expanding Medicare or whatever it is. Like that is what I'm going to go for. And that's certainly a part of the topical literature and a part of like how this discussion is being had in the real world. Let's see what their strategy is.
Can we see the Neville evidence?
Yeah.
Can we see?
Okay. Asking to see evidence. Good call. Good job. You taking prep right now or?
Diplomat, right?
Okay.
Okay, we just got it. Urgent.
Is everyone good for case?
It's a good idea to call for that evidence now so that your partner gets the 4 extra minutes to prep answers. And if they're really clever, that partner that's looking at the cards is going to be able to identify problems which can then be signaled or whispered or something to his partner and inform the questions that are getting asked in cross-examination. So I really like to see that. I like that the cards are getting called now, not after cross-ex, and that they're not taking prep time, just calling the cards, because speech time is prep for everybody who's not speaking. Let me just make sure this is recording.
Ryan and 98. Contention 1 is Afghanistan. Currently, Imzadi 16 for the diplomat writes that the Afghani government has succeeded in signing peace deal, representing a major breakthrough for Afghan stability. Gibbons Neff 20 for the New York Times confirms that the U.S. is planning on pulling more troops out of Afghanistan to accelerate the peace process in the country.
I feel like this is going to be one of those debates where, like, how the issue is actually being discussed in the actual literature is not our concern. And like neither side is gonna be like prefer the strength of our links, because I feel like the links are gonna be pretty strained. But maybe there's clear evidence here. Let's hear it. What's going on in Afghanistan?
Unfortunately, America passing Medicare for all would derail the current peace process by collapsing Afghanistan's economy.
Couple problems with that. One, you need a clear link that says the peace process is contingent on a strong Afghani economy. And two, as you're reading this in October of 2020, Afghanistan, and indeed the rest of the world, is in the midst of a cataclysmic economic downturn, which is at risk of making this argument non-unique. If I'm the affirmative, that's the argument that I'm starting to write right now.
The UN Office of Drugs and Crime 18 reports that due to record high production of opioids, Afghanistan's economy now depends on the cultivation of opioids, accounting for 32% of total GDP. America is key to keeping this industry afloat. As Levine 17 for the AAP explains that after Afghanistan became a major supplier of opium, they've depended on the U.S. market, as 80% of the world's opioids are sold in the U.S. Medicare for All would collapse its market by reducing the sale of opioids in the U.S. As Monkey 17 for the Hill writes that poor health drives demand for prescription opioid medications, so increasing access to preventative care through Medicare for All would stop people from turning to opioids in the first place. Moreover, Lopez 17 for Vox reports that in the U.S. there are hundreds of opiates alternatives out of reach, but that they're out of reach for Americans, concluding that solving the lack of insurance for Americans would prevent these individuals from purchasing opioids. Unfortunately, Bird 16 for Harvard University confirms that due to Afghanistan's weak economy, reducing opium sales would damage the economy in many rural hospitals, leading to more support for Taliban to take over after desperation and anti-American sentiment to take over the country. Allowing the Taliban to win allows them to continue the war. Problematically, the Watson Institute 20 reports that nearly 150,000 people have been killed by the war in Afghanistan.
I could be wrong here, but I'm pretty sure the peace deal in question is between the U.S. and the Taliban. Am I wrong about that? Let's find out. Well, I guess this isn't going to say Taliban exactly because it's, oh, okay, here we go. Blah, blah, blah. The Islamic Republic, joint declaration between the Islamic Republic of Afghanistan and the United States of America to bring peace to Afghanistan. Great. The Islamic Republic of Afghanistan, a member of the United Nations and recognized by the United States and the international community as a sovereign state under international law, and the United States of America are committed to working together to reach a comprehensive, sustainable peace agreement that ends the war in Afghanistan for the benefit of all Afghans and contributes to regional stability and global security. A comprehensive, sustainable peace agreement will include 4 parts: guarantees to prevent the use of Afghan soil by any international terrorist groups or individuals against the security of the United States and its allies. Not guaranteeing for the Taliban to not use Afghani soil, but guaranteeing that they don't use it to attack the United States. A timeline for the withdrawal of all U.S. and coalition forces of Afghanistan. Okay. A political settlement resulting in intra-Afghan dialogue and negotiations between the Taliban and an inclusive negotiation team of the Islamic Republic of Afghanistan. Okay. A permanent and comprehensive ceasefire. How is the Taliban losing here? How is the Afghani government fighting them? U.S. Taliban peace deal. U.S. Taliban peace deal. What to know? They signed it. Okay, so there's a lot of problems with this argument. First and foremost is that you're arguing that we should not get in the way of the opioid crisis because that would hurt. First of all, first problem, you're defending the opioid crisis. Second problem, you're defending it because it upholds Afghanistan's economy, which is probably already in shambles, making that impact non-unique. And third, your impact scenario that you're going for here is that by ruining Afghanistan's economy, the Taliban will not have been defeated, whereas the peace deal you're saying gets compromised is framed entirely around not defeating the Taliban. So those are some problems I have with the case.
Unfortunately, Taliban victory would also spill over to Pakistan and cause instability. Palawal 19 for the University of London explains that increased Taliban influence in Afghanistan would lead to more Pakistani-influenced extremists to rise in terror in India because there is institutional backing from a terrorist group. Indeed, Kenny 16 for the Australian Defence College finds that the success and strong influence of the Taliban in Afghanistan would embolden anti-state actors in Pakistan, leading to the state failure of Pakistan. Critically, O'Hanlon 5 for the Princeton University writes that should Pakistan collapse, nuclear weapons would be in the hands of extremists, making nuclear conflict between India and Pakistan extremely likely, as Pakistani rogue actors would be fire against India and India would be required to respond. The nuclear conflict would be the end of humanity, as Tretvig 19 for the Drive concludes that even a limited nuclear exchange between the two could lead to the health and climatic issues on a global scale, creating a nuclear winter which would cause human extinction. Contention 2 is the stock market. After 8 months of the coronavirus, Wolf 24/538 writes that the economy is on the rebound, with unemployment falling below 10% for the first time since March. Unfortunately, White 20 for NBC News finds that even though the U.S. is slowly moving towards a recovery, a second shock would easily push the economy into depression. As a result, staying on our current path is key to sustain our fragile economic recovery. Unfortunately, Medicare for All would redirect us towards economic disaster by eliminating private insurance. Abelson 19 for the New York Times finds that Medicare for All would abolish the private insurance industry by replacing it with a government-run system, concluding that the move would decimate the healthcare sector, which makes up 20% of the entire U.S. economy. Abelson furthers that the bill would not give compensation to the millions invested in private insurance companies whose stocks would become worthless overnight after Medicare for All would pass, leading to extreme capital flight and industry collapse. Indeed, Epstein 19 for the Hoover Institute explains that banning all private health insurance through Medicare for All would drain trillions of dollars from the stock market, resulting in havoc in the economy. The impact is economic collapse. Howard 17 for Fulcrum Strategies writes that if the healthcare industry collapses, the economic effects would make the 2008 housing crisis seem minor in comparison. Problematically, Bradford 13 for the Huffington Post concludes that the next adverse economic shock, like the 2008 housing bubble, would push 900 million people into poverty. Thus we negate.
All of that seems either non-unique or just not that big a deal, considering...
Can we see the weak economy allows Taliban to take over?
Yeah.
Cool. I mean, I don't like it. I don't know what to say. I said what I would look for to see run, and I don't know. Just seems like maybe the whole strategy is to goad the affirmative into saying the opioid crisis is bad, and then there's a whole back strategy that is maybe with some sort of critical framing is going to then try to make that the voting issue because of the way they approach discussing the opioid crisis. Otherwise, I think non-unique, the economy already sucks. No, the Taliban, or turn, the Taliban is winning more by the trade deal, by the peace deal happening. So by compromising the peace deal, we are not creating the perception that the Taliban won, which then turns all of your Pakistan spillover arguments and gains us the extinction nuclear war scenario, and I don't know. That's pretty good. All right, let's see what happens. Is this prep? What's going on? Yes. Okay.
Okay, both are sent on the email chain. First question.
Okay.
All right. I mean, what I'm worried about is that by the affirmative calling for the card that says, hey, can you show us the card that says that we compromised the peace deal, they are going to try to no-link that argument rather than turn it. Because the turn is the much more effective way of doing this. Because you capture the nuclear war scenario. You essentially de-link out of it happening under the AF, but you link into it happening under the negative, they can't then come up and read answers for why a nuclear war scenario is not likely to happen. It's just the most efficient way of doing it. And the only thing they have is an unwarranted... their cards that talk about a Taliban victory are probably not talking about in the scenario of the peace deal that we're talking about here. If they are, sure, you want to delink it. But if they're just talking about like the Taliban winning in general would embolden stuff in Pakistan, then I'm definitely going to look to make turns. Okay, let's see how this goes.
So you say with stocks that like Medicare for All would abolish the private industry, which would push 900 million people into poverty. So why would the bill provide no compensation to investors?
I don't like that question. Because if you know that the bill does provide compensation to investors, then you're not gaining anything here. You just say in the next speech, hey, it provides compensation, right? It's like a non-question, because your entire strategy is what, to like maybe like put this other debater in a corner, and then they have to like, oh no, I didn't know that they provide compensation. Probably what's going to happen instead now is that this person has a platform to try to preempt answers to that argument and try to get ink against it. Not that these judges are necessarily flowing, but are trying to... You're just giving them an opportunity to answer your argument earlier. You're not benefiting... The argument's not going to be any stronger when you make it now. But let's hear how this is answered.
So the bill just doesn't have a provision in it to provide compensation to investors, but more importantly, it's like a perceptual link, right? Like the Abelson and Epstein evidence make it very clear. Like, for example, like we have a different piece of evidence like from the week that says that just when Democratic candidates started talking about Medicare for All, immediately like investors started fleeing and like the stock started getting impacted. So like there's time too. Let's talk about your second contention about access. The first piece of evidence that you read in this says that
we're working on a website just so we can put blog posts up so that we don't have to make videos when we talk about stuff. And then those blog posts can get cut for evidence. And I know it's mostly Paul that's excited for basically writing cards for people to cut. But I think I would like to write one about why perception links are bad. Because they're all predicated on this idea that you can predict what perception someone will have and then predict what actions they will take based on that perception, even when those actions are in that person's or not in that person's best interest, like global extinction. So look forward to that.
Developing countries pay the highest prices, but then in your first one about reimportation, you say that American prices are higher. Which is it?
Well, the argument is that overall the developing world pays more than developed countries as a whole, which includes countries like Europe. So like the US can be the highest, but on average the developing world still pays more.
Sure. So then why is reimportation a fear?
Because reimportation is a fear because it's the commander evidence, right? So if they sell drugs at a low price in the developing world, then they can get resold to the United States for cheaper, which like undercuts the profit.
Right, but the Neville evidence that's at the top of your case is that these countries pay more than the United States.
I get that. That's clever, but if there's one country that pays very little, you import from there, right? The answer is most of them pay a lot. Some of them pay very little. And for that, it's great. Those get cheap prices, and if you want to read some sort of diss ad that says we compromise this, then great. But the point is that we import from the cheapest places, which are few, and we resolve the problems. The import would be from the cheapest places, and then we resolve the problems from places that are paying a lot because they get to create their own generics. It's a clever contradiction to notice, but it's not something that an effective affirmative can't get out of.
That's the point. They pay more in the status quo. They can't lower the prices because of the risk of reimportation.
Okay, but reimportation is only an issue. Like the internal behind reimportation, though, is that fearing that they're going to be undercut once people re-import.
This argument only works if you imagine all foreign countries as being one block, or all developing countries as being one block, with one set of medicine prices, which it doesn't have to be, and that's how I would get out of this if I was the affirmative.
Them back into right. So that relies on the logic that it's paid, that like the people who are like on the black market are paying for it cheaper in the developing world.
Reimportation doesn't happen in the status quo. That's the point, because we don't have Medicare for all, like, because they're selling at high prices in the developing world now. That's the argument. Like, they're selling at high prices because reimportation could happen if they lowered prices. Huh?
What are you changing then?
The threat of reimportation goes away.
But you're saying that it's high right now, so then why is there a fear of that right now? You're saying that
there's a fear of reimportation because prices are high. Okay, prices are high because there's a fear of reimportation. If they lowered prices, then they would get sold to the U.S. undercutting because we have really high drug prices. If we lower drug prices in the United States, the fear of reimportation...
The first AF speaker isn't quite understanding what the neg speaker is asking him. And the thing is that this question isn't really getting anyone that much farther ahead in the cross-examination. I mean, it's by the negative speaker, like, staying on this question, then I guess it prevents another question being asked. But, so it's maybe in the negative's best interest to keep rephrasing and re-emphasizing this, but I mean, just going by the judge in the upper middle, like, I don't think that this is like a super productive cross-examination. And given that the affirmative has only had one question to ask so far, I'm concerned that this is going to take away any chance for them to tackle the questions of, are you saying that the opioid crisis, that we shouldn't pass Medicare for all because it would end the opioid crisis? That's a great question. Or the question about, like, a question about how the peace deal is not the Taliban winning, when we're literally declaring peace with them. But anyway, let's see how much longer
it doesn't
this
exist
goes.
anymore, so they can lower prices in the developing world. Can I have a question?
To clarify, you're saying that the price, in order for reimportation to not be issued, the price needs to be the same in both markets.
Price needs, it doesn't need, what? I mean, like, if there's like a minor price differential, that probably doesn't matter because there's like still shipping costs and stuff, but like overall the prices.
Like minor, but like overall,
Okay, so on your first argument about Afghanistan, you say that like the terrorists would get access to nukes, right?
Yeah.
So like, why wouldn't the U.S. military launch an intervention to get a hold of the nukes?
I mean, I'd say that
is not the argument. What? How are you going? How? Like, we're not talking about like a grand announcement is going to happen and then the nukes have to get carried from one place to another, and the United States, which through the peace deal will not have military bases there, will then swoop in and prevent it from happening. Like, that's not the argument on the nukes. That's not the part of their link story that is flawed.
That just emboldened the Taliban even more. That's like an independent into our
But if we get access to the nukes, why does it matter?
And that it emboldens them even more is not the response. The response is you can't. How are they going to intervene on the person with the code becoming a person who is a terrorist? Like, a terrorist gets the launch codes and access to it. Like, how are you going to prevent that? Like, that happens in like an hour. Whatever.
Well, first of all, we don't know where Pakistani nukes are hidden. Like, if we did, then we would have done something about it.
I mean, if we like take control of the country, then like no one can get access to the nukes anyway.
How is that going to happen if we just removed all of our
in what
troops from
scenario do we take control of the
Put them
country?
back in.
Like, how long will that take? Like, the Taliban will have control over that way before the U.S. intervention.
That's time. We'll run prep.
I want to be polite. I've certainly had rounds where I made arguments that my coaches thought were not good, and I saw them kind of pull their hair out and roast me. And I don't know, like, I feel bad because this is unsolicited. These debaters have not asked to be roasted. But and I'm not saying that this is a roast like I'm saying they're bad. But I don't know, I feel uncomfortable because it's like I have major problems with the arguments. And I feel like it's probably for the benefit of the general populace for that to be pointed out and discussed, and these debaters signed off on this being put out in the public. I don't know. I think they're very talented. I think I'm sure they had a very strong year moving forward from this point. I just don't think they're seeing the forest for the trees is the issue, right? They're hearing an argument and they're like not identifying the useful responses. They're not identifying the turns. You're not identifying the no links. You're just at least the right no links, right? You're going with your first instinct, and the instincts like aren't.
Stop rep. That's around 2:30 total. So we got 30 seconds or 1:30, I guess, if we're on 4 minutes prep.
It's just the round vision's
It's
not
just going to be
quite
down
there.
the neg.
Though maybe it will be from this debater because he doesn't. It's a different person asking the questions. So let's see. The second speaker on the AF can totally turn things around.
Let's start on their Afghanistan argument. First off, their link is all about opioids. If opioids don't go down under Medicare for all, then they don't have access to their impacts. Universal coverage.
Why would you? They say opioids are used to treat sickness and serious diseases. And the link to it going down is that there's going to be less sickness and serious diseases. So you probably want to argue that yes, they will go down, but that is good because, by the way, there is an opioid crisis. But, okay, I'm done yelling at children.
Doesn't help stop opioids. Humphrey 19 finds that Vancouver provides universal insurance and has much less economic inequality, yet has nearly identical rates of overdose deaths as West Virginia. That's because they don't address the root causes. As Das Gupta 18 finds, researchers agree that factors such as opportunities, working conditions, and hopelessness are the root cause of the misuse of opioids.
Yes, in the case of misuse of opioids, that would be a good answer. It wouldn't be the best answer because you probably would benefit from talking about how you prevent opioid deaths, and that is good. But in a world in which the negatives links were drug misuse, then that would be a fine no link if for whatever reason you thought the best strategy was to no link out of ending heroin overdoses. But in this case, the negatives links isn't drug misuse. So your issues of like diseases of despair and whatever is not relevant. They're literally talking about like people getting surgery and being given a friend of mine just had a kid. She just gave birth, and in that process was given fentanyl, which is an opioid. Like, these are a regular part of the medical process, and they're used a lot for things that involve pain. And the link from the negative is that you are decreasing the number of emergency surgeries that need to happen because of like failed organs by making the populace generally healthier. Of all of the links they have, that's a pretty solid link. So I don't think you're going to no link here successfully.
Second, they have no evidence that says that most of the U.S. purchases of opioids come from Afghanistan. We would say that most. most of them don't. Many of them come from Myanmar, but for the most part, they are coming from the growing fentanyl markets coming from China and Mexico. We can make them synthetically, which is why we don't need the poppy plants in Afghanistan. Third off, the Afghanistan Taliban and all these terrorist groups can always just diversify into mining or other drug markets. If we aren't purchasing opioids, they can always just try and sell opioids to other developing countries. There's nothing unique about how much money they're going to be losing from these opioid markets.
They're losing 80% of their market. And also they could do a lot of things, but you don't have evidence that says they will do those things. And if it's just not that strong a response, right? Yes, Afghanistan could, the Taliban could start mining, and as someone once said, if my grandmother had wheels, she would be a bicycle, right? That doesn't mean anything that Afghanistan could, post-plan, decide to start mining. That doesn't... What does that do? I don't know. Did they see... I guess one of the benefits the Afghanistan argument has is that not a lot of people are prepped with cards to answer it.
On their Taliban link specifically, first, their link is that the Afghan economy will be damaged, which means that recession links in just as well. That's why you can turn it, as cutting out household costs would save the economy, as Lopez 17 finds. Our healthcare system is causing damage to the economy. We can handle rising costs with good policy or do nothing, which would result in more rising costs and ultimately recession, as household resources.
One of the other things that frustrates me about econ arguments is that people don't read quantified links and impacts enough, or really ever. And so the only links you get is money goes up, money goes down, without any quantification of how much money this link makes go up or down. So this answer here is hey, that economic collapse won't happen because we will reduce the cost of buying medicine, which some of your costs can go down. The cost of buying a house certainly went down during the 2008 financial crash, but and yet the economy still collapsed, right? Sometimes there'll be some prices going down, but then a lot of other prices going up, and then overall the price went up, right? So that's why quantification matters, and why econ debates are frustrating to me, because that quantification never happens because everybody's talking about predictive evidence without cards.
Go towards medicine instead of homes or clothes. We are headed to the biggest recession ever, and if we don't implement Medicare for all, then that triggers their war scenario. Second,
why wouldn't you just say that the biggest recession ever makes it non-unique, rather than we're heading towards the biggest recession ever, but my AF solves for the economy of Afghanistan losing its drug market?
Also spread to Afghanistan, which increases the likelihood of wars that they talk about, because these terrorist leaders need somebody to blame, and people are going into poverty, which increases the terrorist people's power. Third, their evidence doesn't say that the Taliban would rise or overthrow the government. It just says that they would get more support. Just because they have more support doesn't mean they overthrow the government. But fourth, the U.S. would fill in if the Taliban started to rise, stopping them in their tracks, just like we did with ISIS. Then they'll just, when ISIS tried to rise again. The U.S. can also invade Pakistan or Afghanistan to get control of their nukes before they can actually fire them. That's the cyber operations capabilities that we've had, and we have troops in the...
ISIS did a lot of shit that we did not intervene on. I recall a journalist getting beheaded. I recall seeing videos of a river getting filled with hundreds of corpses. And I think all of that is more difficult to accomplish than launching a nuke that you have access to, because those things are made to launch quickly. So I just don't think these are the right responses. But they're very talented debaters, because let's be honest, he's doing a good job. what this debater is doing right now, even though I'm sitting here in my fucking armchair and being like, well, actually, that's not how the government works. That's not the economy. I'm not in that round. He's very eloquent, he's very quick, and he's getting shit on the flow. And maybe some of that stuff will be answered, maybe it won't be, right? These people are very talented, or else more people would be able to do what they're doing, or else they wouldn't be at the octos of a tournament that probably has an octos bid. They're very talented, they're good at debate. It's just that certain communities of debate don't really emphasize accuracy of arguments. And accuracy of arguments is something that matters to me personally a lot. So I feel some type of way when I hear a bunch of arguments that I don't feel are accurate. And then I expect the opponents to come up and be like, here's why that's inaccurate. But that's maybe not even the most effective way of handling a debate like this. So, I don't know. I don't want to keep being grumpy during this debate and acting like these people aren't doing a great job. They're doing a great job, and they have every reason to be proud of this performance. It's different than what my priorities would be in a debate. But I think at this point, we're not really looking for accurate evidence and likely predictions, let's say, moving forward in the round. So moving forward, let's exist in the tabula rasa world where everything they say is true until someone disagrees with it. 1, 2, 3, go.
Indian Ocean and stuff that we can infiltrate and make sure that they do that before deterrence puts in. Also, we outweigh on probability because because Pakistan didn't start war with India before, and also Pakistan and India had a war in the 20th century. They did not use nukes. It is the only instance when two nuclear powers had a war against each other and no nukes were used. When nuclear war is highly unlikely due to mutually assured destruction, no one wants to use nukes because it would destroy everyone's populations. High magnitude but low probability impacts are extremely bad because it would cause policy paralysis.
That's not the same actor. The Pakistani government and the Taliban or whatever other terrorist organization is not the same actor. So saying they didn't use it before doesn't mean they won't use it now. There's the terrorist organizations tend to have eschatological philosophies and are framing themselves towards some sort of apocalypse, or at the very least do not shy away from martyrdom, thus like suicide bombing, right? So those would be the answers I would give against the terrorist wouldn't blow themselves up.
Every argument can find a link into nuclear war, like our pandemics arguments could enrage Kim Jong-un, which could fire a nuke at Japan, then that just means that every argument has some tiny chance at nuclear war, which means that no policies would ever be passed, which is bad. Go to the stocks arguments. First off, companies would be fine.
That's something I hear a lot about. This weighing
bad
here.
Because it would cause policy paralysis.
Policy paralysis.
If every argument can find a link into nuclear war, like our pandemics arguments could enrage Kim Jong-un, which could fire a nuke at Japan, then that just means that every argument has some tiny chance at nuclear war, which means that no policies would ever be passed, which is bad.
This argument is only useful if you've already shown that your nuclear war scenario isn't going to happen, right? You wouldn't say it would be bad if the United States had certainty that doing a particular action would cause a nuclear war, but we can't let that concern slow us down from doing the action that is certain to lead to nuclear war, right? It only works on the presumption that the policies that we are considering don't have a credible chance of creating a nuclear war. And the way we measure whether the negative's arguments are credible or not is through your ability to respond to them. So, my only criticism of that impact framing is that it requires you to already have beaten the arguments that you're trying to outweigh. Which at this point, like, what is that accomplishing for you? You've, in theory, already beaten those arguments by showing that they're not going to happen. I suppose it prevents them from saying, hey, I know there's a near zero chance of this happening, but you should vote for us anyway to prevent that near zero chance. But in my mind, that only wins if you have basically no impacts to weigh that against, because I can't imagine any other scenario where that outweighs. So as long as you're answering the argument right and you have your own strong impacts to go for, it just seems redundant. But yeah, I see this framing, I guess, talked about.
Go to the stocks arguments. First off, companies would be fine. Katz 19 finds that health insurance companies which have additional lines of business would survive. Second, Medicare for All has 4 years to be implemented, which means the companies can diversify in the meantime. Silverstein et al. 11, health plans push businesses to international markets, health IT, and holistic health innovation strategies. Third, you can turn it as diversification actually increases company value. Reddy et al. 19, investors view growth into new sectors as a way to increase higher access revenue streams. Value increases in the long term. Fourth, turn it in the short term, high stocks will prevent coronavirus stimulus. Ponsec 20 finds that market buoyancy will undo the urgency for more economic stimulus. If the market stays up, chances of deals in Congress this year are likely to approach zero. Stimulus is needed to prevent this recession from getting any worse. As Longcoast 20 finds, the best tool to prevent a downturn is another stimulus package. Concern about a backslide is getting more serious every day. Unemployment claims have climbed and spending has retreated. That means that their argument is not unique. We're headed to a downslide already, but also it means that we solve. Prefer you because you know that the current recession has lifted tens of millions of people out of property, meaning that's more probable. You know that pandemics cause recessions, which is always so why our fourth contention links in. And also, the stock market doing well empirically doesn't help consumers, as unemployment is rising right now with a booming market, which clearly means that the stock market doesn't have high correlation to the economic growth of the United States.
Yeah, so we're gonna need some evidence. Can we see Humphrey? Can we also?
Yeah.
Okay, so I think I just got it. It just a card for your like diversification. It's fine. Okay, is everybody ready?
Assuming that the negative correctly identifies the link takeouts that don't really work coming from that speech, I mean, I think they're ahead in this debate on the flow, right? Because I think they're peace deal gets compromised arguments have been conceded. I think the only challenge there is that the economy of Afghanistan could probably be fine, but that's just like time frame. Like how quickly after starting to change your industry to mining are you gonna find something worth mining? And well, Afghanistan has a lot of mountains. I don't know what's in them. Or likewise, like finding new people to sell drugs to, right? Like there is a time deficit there, which I would, as the negative, use to my advantage to say that gives more credibility to the peace deal is compromised at least, and that's probably all I need because my actual link to nuclear war is not the collapse of the Afghani economy. My actual link to nuclear war is the perception and the emboldening of Pakistan's extremist groups through the perception that the Taliban is winning. And that perception, I'm winning on the flow, is based on that peace deal being compromised. So as long as it's compromised in some way, I have some link to there. At that point, the only stuff that they have is, well, why wouldn't the United States government swoop in and take, like, we're not at war with Pakistan, right? We don't have, like, there's reason enough to think that there's not going to be an immediate enough and effective enough military prevention of arms landing in the hands of terrorists, which is why nuclear weapons in an unstable country is, like, a big deal. That's what I would go for, right? The only other argument is that they don't have an incentive, which they don't need to. I think we overestimate, not just in debate, in the world, we overestimate our ability to predict what rational actors will do, because I don't think people are rational actors. I think people are irrational actors, or else we wouldn't have so many problems all the time. I think governments especially are irrational actors, largely because of bureaucracy, but because of a lot of different reasons. So that's what I would go for. At that point, this person does not really need to attack much of the impact on the affirmative, because the only argument they have with, like, that scale of impact is the even bigger pandemic, which is probably outweighed by or triggered anyway by a global nuclear holocaust, right? Fun fact, there's no fun facts about that word, but little do people know that the Latin for that word means mass death by fire, which is why people use that term with nuclear. In any case, I think at that point the weighing of policy paralysis doesn't get you out of it, because that assumes that the risk of nuclear war happening is negligible, and similar to the affirmative's access to nuclear war scenarios. If they show that they have a more significant access to that impact and that comparison is invalid, then that should pretty much take care of that impact framing. Unless you want to show that governments should never be responsive to credible threats of nuclear war.
Starting our first contention about Afghanistan, they try to read a economic growth link in and read this Lopez evidence that says economic growth spills over to Afghanistan. Two responses here. Number one is Fishbot 19 explains that Medicare for all will require increasing taxes with at least 2/3 of Americans with less money overall, which means the economy doesn't grow. But number two, if we win any link into econ decline, it means that we also have an internal link into any nuclear conflict scenario. Go to our first contention about the stock market. They read 5 responses. First, they say that healthcare facilities have other sources of funding. 2 problems here. Number one, our argument is that they literally abolished the industry. It doesn't exist anymore. Number two, even if they are diversing to other types of funding, it's 20% of the GDP that gets wiped out after Medicare for all. Their second argument is that it takes 4 years to actually implement. The big problem is that investors are going to pull out on day one if they know that in 4 years their investment is literally going to be worthless, which means that they literally are going to happen on day one right after you pass Medicare for all. It doesn't matter whether there's a transition period. But the third argument is that investors are going to diversify. 2 problems here. Number one is our Abelson evidence explains that investors are not compensated under Medicare for all, which meaning that they can't diversify. Number two, under COVID-19, they're already uncertain in the stock market, which means that if they get money back, they're never going to reinvest it in the rest of the stock market. On their fourth turn, they say that it prevents a COVID-19 response to stimulus. Two problems here. Number one, our recession is uniquely worse because the Howringer evidence at the bottom of our case does a unique comparative analysis that explains that our recession is even worse than the 2008 recession, which COVID-19 is not worse than, which means that our recession is always going to be worse, which means that we still have a unique impact. But number two, their impact is not unique. On the stimulus argument, Relentless 20 of Market Watch explains that Congress is not going to pass a stimulus either way, which means that our offense is the only unique recession that happens in the round. Their last argument is that the stock market doesn't actually help the people, like the people in poverty. But sure, even if the stock market going up doesn't help people, when the stock market crashes, the overall economy crashes, and that hurts the poorest of the poor, which means we still haven't linked in. Our argument outweighs their case for 4 reasons. First is Bozzoli 14 explains that hospitals close during a recession, which means that preventative care never happens. Number 2, companies don't sell to the developing world and do this reimportation like price gauging because they're in a recession. They don't change the policy. Number 3, our new generics from their evergreening argument are never going to pop out during a recession because small companies aren't going to come up and build these generics because they're focusing on like covering themselves from the recession. But fourth, our argument about recession outweighs their pandemics argument because during a recession, for example, recessions always make pandemics worse. For example, we wanted to open up the economy because we were in a recession, but it only made the pandemic worse. Go to the case. On their first contender about preventive care, 2 responses. Number 1, it's literally one of our links, but number 2, our turn the argument. When 20 explains that we're already at full capacity in the status quo, which is why when you increase demand and increase coverage, it leads to wait times. The EUC 20 finds that 422,000 people are going to die from wait times, which outweighs their argument on scope. But then on their second contention about global access, as a general response, Commodore 11 explains that developing countries only pay 6% of U.S. price. Prefer our argument because we have a warrant. Our warrant is that they have to adapt to the people that they're actually selling to. They have to sell at a lower price, which is why Lachawala explains that 200 million people have already been saved by U.S. pharmaceuticals. On their first warrant about reimportation, 2 problems here. Number 1, Kyle 08 explains that analysis of 30 countries and 1,000 drugs finds that parallel trade has no impact on pricing. Number 2, Medicare for all does not mean that decreasing prices in the U.S. leads to decreasing prices in the rest of the world. It's just decreasing prices in the United States. They have no link there. On their second argument about evergreen, 2 responses here. Number 1, the WHO finds that the WHO has removed patent requirements to the developing world till 2023, which means that they can get access to generics from other countries in the status quo. But number 2, Kim 20 explains that innovation in the status quo is really good right now. He explains that 41 new antibiotics are being developed in the status quo, which means that right now the evergreen process really isn't that bad. Biotech is still doing well. On the third contention about pandemics, 2 responses. Number 1, it's a matter of management, not our system. Trump knew about the pandemic in January, but didn't close down the country because it's a matter of management. Taiwan had a different culture. They literally locked down the entire country. But second, turn the argument. Norquist 20 explains that not having single payer and regulations allows the U.S. to have a better response to the pandemic, which is why he concludes that we had more hospital beds than these other single-payer countries, but also he concludes that the U.S. is leading the one in vaccine research, which is why he concludes that we need to not have single-payer to allow us to respond better to future pandemics as well, which means we outweigh on time frame. They link into one pandemic, we link into infinite pandemics in the future.
Okay, I don't like the framing of like one pandemic versus infinite pandemics or our... that one's okay, but I don't like the framing of like our recession is bigger than their recession or whatever. But those are like really the only parts of that speech that I had a problem with, right? I think that speech didn't go for the nuclear war argument as hard as I would have liked. It's not really mentioned specifically, but the links that lead to there are defended with the econ collapse in Afghanistan. So that's still on the table. And I think the other arguments were solid. Like if we're looking at a flow and we're looking at how, like the line by line, I think they were quick. I think they were concise. I think they were effective. I think he used his time very well. He probably did what he needed to do in this speech to get them closer to winning.
Cross?
Yes, sir. Henry, you can have the first question.
Yeah, okay. So you say the prices are only 6% in the developing world. Does this evidence account for all drugs?
What do you mean? What?
Like, which drugs is this evidence analyzing?
What do you like?
What evidence?
I'm pretty sure. Like, I can pull up the evidence right now.
Right, because we would say that, like, to say that all drugs, like, what is the comparisons from? Is it U.S. prices to developing world prices? Because what I don't understand is if prices are so low in the developing world, why can't 2 billion people afford drugs?
I would say that either A, that means it's non-unique, they're selling at their lowest point in the status quo and 2 billion people still can't access it, which means that neither of us have solvency. But number two, I would say that your argument doesn't really necessarily interact with our argument, that because we have a warrant on why, like, in the developing world they have to sell lower, while you're like Neville, I think, evidence, like, just it's very unclear. Can I ask you a question?
I think that question was fine. I think it accomplished what it was trying to accomplish, fine, but I think it lacks some round vision in my mind. I think we are on the flow beyond the point where increase of, like, drug affordability, unless you want to say you save those 2 billion people outright, which, like, you don't. It's just those aren't the big impacts that we're going to be talking about in the final focus. And so you need to start building, you need to start paving your roads toward the things that you are going to talk about in the end.
It isn't high. Yeah, sure.
Great. Okay, so let's talk about let's talk about your second argument about evergreening. Is it that, like, we promote more, better innovation, or is it just that we remove companies' patents?
It's just that we don't buy Me Too drugs, basically. They're only used to extend patents.
Wait.
Can I ask a question?
So your link is removing patents, right?
No.
The link isn't removing patents. It's removing Me Too drugs that are used to extend patents. Can I take a question?
So you don't.
How do you remove Me Too patents? Because it wasn't a case.
The government, the Narayanan evidence, like, explains it pretty clearly. The government just buy Me Too drugs. They buy the original drug. If they're already buying the original drug, there's no reason for them to buy the Me Too drug. Like, if a company makes, like, a drug, and then they make the drug 2.0 that's almost exactly the same, the government's just going to be like, hey, no, we're just going to buy the original because we know what you're trying to do here, right?
Wait, so if they just buy the original drug, how does that link into global access for the drug?
Because it means that the companies have no incentives to create those Me Too drugs, which they also use to extend patents in the developing world. Can I ask a question?
Yeah.
The question you want to ask is, why don't the drugs that have not had their patents extended, I mean, is the argument they stop making the first drug in order to make the new drug, which now has a patent, but the other thing is not available? In which case, when you say the government won't buy it, like, what do you mean? Like, the government can control which drug a drug company is selling, or they have to ask permission for the government to stop making drug A and now make drug B instead? You're saying the evidence makes it clear, but I'm not clear on that.
You say, is, like, the warrant in this fish bomb evidence your response to the Lopez turn that taxes will increase?
Yeah, it says taxes would increase under the bill. Can I ask you a question?
Why would the government increase taxes in the midst of a recession?
Well, the resolution is, should we pass the Medicare for All Act of 2019? The bill is funded by taxes, which is why the fish pot evidence explains.
Okay, does it say anywhere in the bill that it needs to be funded through taxes?
The funding mechanism in the bill is taxes. Can I ask you?
I want to see that part of the bill, because I've been doing this topic for a while and I've yet to see the part of the bill that says it's funded through taxes. You can take a question.
Great. So let's talk about your patents thing. How do U.S. companies not selling their, like, 2.0 drug mean that they can influence patents in the rest of the world?
It means that, like, if they made that drug, they would make no money on it in the U.S., which disincentivizes them from making the Me Too drugs overall, which means that patents can't be extended in the developing world.
Okay. Can we see the evidence that says decreasing prices in the U.S. would mean that they can't get patents in the developing world?
I mean, yeah.
You're saying yes.
I mean, yeah, we can send the Narayan evidence.
Okay.
Bad drugs extend patents in.
Companies continue to hold.
Okay.
Like they.
Medicare for All wouldn't let them have patents in the development.
What's happening?
Misunderstanding.
Let me know if you guys don't have it yet.
I think we might have had a misunderstanding. I just wanted the part that said.
Yeah, saw that coming. He asked for a specific warrant in the evidence, and you sent the card that didn't have that warrant, but you're like, the card overall should. Yeah. Let's watch them argue about that for a minute.
and talk about that. Turn, then go to our All right, it's going to start on our C1, address the turn, then go to our C3 way, which means I'll be addressing their weighing, and then I'll go to the neg and talk about that. Is everyone ready? Cool. On the turn on our C1, they say there's wait times. That's not true. Waldrop 19 finds that on average, socialized medicine have less wait times because there's less administrative work, but for us, because ours is an average, whereas theirs is just one specific example. Go to contention 3 about factory farm. Extend the high D evidence, which says that factory farm pandemic is literally inevitable because of the unsanitary and unhealthy conditions there is. The Zimmer evidence says that Medicare for All would solve because it consolidates data, allows us to find hotspots and make better public health decisions. Williams says that there would be only 7 coronavirus, there's only 7 coronavirus in Taiwan because of the system. In the Parmaro evidence says that 100 million people will be pushed into poverty, extreme poverty, because of the coronavirus pandemic. The next pandemic could be 100 times worse. Then on their responses, they say that it's a management issue, Trump didn't close it down. The first argument is that we have no idea who the next president is going to be when the next pandemic comes. We would say that you should prefer solving the root cause rather than guessing who's going to be in the administration. Second, the argument isn't about the shutdown. It's about the researchers in the federal government who can find hotspots and then distribute testing kits and issue lockdown orders that are more specific to that region. That's why it's a lot better. Trump isn't involved in that process because he's not a public health official. Then they say with the Northwest evidence that the U.S. is a better response because we have more beds. Just because we have more beds doesn't mean that our death rate is better. Obviously, the U.S. has performed much worse than socialized medicine country. The Williams evidence says Taiwan has performed a lot better. Then they say that the U.S. is leading vaccine research. There's no warrant in this evidence about why Medicare for All would solve. Secondly, it's about stopping a pandemic after it's happened. We could stop the spread before we even need a vaccine in the first place. We outweigh because a recession is inherently short term. The 2008 recession happened, and then literally global poverty was at an all-time low a few years later. However, pandemics will continue into infinity until we stop them. Their recession is a one-time deal. Ours literally happens until infinity until we solve the problem. They say their fourth piece of warranting is that recessions make pandemics worse. There's basically no warrant in this. Our argument is that pandemics trigger recessions in the first place, which is a prerequisite argument and has to come first. We're winning the weighing. Also, we outweigh.
At this point in the debate, if I'm a judge, I am not voting on any argument that requires that is stemmed off of a pandemic link, because I have arguments from both sides saying that their pandemic scenario causes pandemics infinitely into the future. And so at that point, I'm just going to guess pandemics are non-unique, which realistically speaking, they probably are. So at that point, I'm going to look at non-pandemic related arguments, which on the affirmative, the speaker right now is doing a pretty good job. Pretty concise, going through issues, has selected issues, is going for them pretty well. I think some of the argument selection, well, I mean, in this case, you're going for an impact that the other side's already going for without cleaner links necessarily. So I don't know that that was necessarily the right impact to select for this round. It could be the case that this is the argument that they collapse to every summary or 80% of the time. And so they're just used to collapsing down to this. But you want your collapse to be reactive to what the flow looks like in this round. And here, it's not so much about the ink against it, but also about what impact weighing are you setting up for the next speech? Because now it's not about impact comparison, because you're going for the same impact. It becomes about strength of link. Can you win the strength of link argument here? Seems like a really messy situation and very unlikely to get a 3-0 on, right? Your best case scenario is that you go 2-1, because it's just very hard to get 3 judges to buy that level of minutia. The other scenario, the other extended argument here is the lives saved from preventative health care, which I like your links there. Again, I like the arguments to begin with, but I think the affirmative has correctly identified that their hands are a little tied in terms of how many lives they can argue that saves, which is probably why they're going for the pandemic argument, but I would maybe we'll get there. But we need to do more work on the negatives impacts.
On probability because they've conceded the Heidi evidence, which says that a next pandemic is literally inevitable, whereas their case are all projections of what could happen under Medicare for All. Let's go to the neg. On the negatives in the Lopez turn, we're heading towards recession now because high healthcare costs are stifling consumer spending. They say that taxes would happen. Republicans hate taxes. The bill leaves the implementation of the bill up to Congress. It just gives suggestions for taxes. We say it's probably more likely we just deficit spend. At that point, the only way to save our economy from a recession is to increase consumer spending by decreasing like healthcare costs, which means that their recession is at least non-unique, but it's also a turn because it means we could literally save the economy because if consumer spending increases, then the stock market would also grow because our economy is doing better. The second thing you can extend is the silver sign evidence that says that the companies would diversify into like health, IT, and global. They say like investors wouldn't diversify. The argument isn't about investors diversifying; it's about the like the healthcare companies themselves diversifying, which means they don't have any adequate responses. The ready evidence is that investors want them to diversify, but since these companies are so stubborn, they're not doing it in the status quo, which means the stock market literally goes up because there's more diversification in there.
They're so stubborn that they're not doing it in the status quo, but not so stubborn that you can't accurately predict what they are going to do given a set of circumstances, right? Like that's what I don't like about perception links.
Which means we have a pretty clear link into stocks. Don't let them read new arguments in second summary. It's too late.
Can't
remember.
To be clear, if you're going to bring up nukes, now is the time. I feel like you have a pretty clean link into nukes, and it's the biggest impact in the round. The only answer is that they would be stopped from getting it, which I don't think they will, and that people shouldn't evaluate nuclear war impacts that aren't likely to happen, which, if you win the argument, that means it's likely to happen. The way we determine whether an argument is likely or not in a round like this, especially, but also generally in debate, is based off of ink on the flow.
It's going to be starting with their weighing, our weighing, their case, our case.
Wait, I even didn't hear that.
Their weighing, our weighing, their case, our case.
I'd like maybe a cleaner overview here, because I feel like if you're starting with their weighing, you're either telling me to reject it or you're telling me why you win under their weighing. If you really win under their weighing, then don't go for your weighing. If you're not really winning under their weighing, then what you're going to be doing is probably making responses as to, here's why we kind of do well under their weighing, but our weighing is ultimately going to be better, which means that you're going to be like trying to get things on the flow that you haven't said yet. You shouldn't make arguments that refer to something you're going to say later. You should organize them the other way around. So even just like a little overview. We're going to win because of this weighing. Let's talk about their weighing first and then elaborate more on our weighing. And that way, if I'm flowing, I know like what it is specifically that you're saying is going to outweigh this. Because if you don't tell me what's going to outweigh it, then I have nothing to write down on my flow and it looks like you didn't respond to it.
Right. Okay.
Starting with their weighing, they say three things. First, they say that recession is short-term, which means that it doesn't even matter. That's not true. Recessions have super long-term impacts. For example, there's intergenerational poverty, which means you should be looking to that first. I'll get to the why time frame matters more later. But then second of all, they say the prerequisites because they say that they cause a recession with pandemics. That's not necessarily true, A. But B, we'd say that it's the culture of pandemics that's going to exist either way. Pandemics are going to happen either way. You can't just necessarily prevent them, so they don't actually do prerequisites. But then
you don't have an impact for the recession. Right? I don't think in the first argument there was an impact card for, hey, this recession happens and this many people die. I think the recession argument functions as a turn, and I think, like, at that point, like, it's a question of links, right? So, I don't know, maybe I missed it. But in my mind, it's less about why a recession matters and more about how the existence of a recession alters the other link scenarios that are happening, right? Like, for example, the preventative care argument is an argument that happens in a vacuum, right? The evidence talks about, in this world, if we're normally going around and then this change happens, this result would happen. That evidence is not speaking about a scenario where a global recession has happened. It's not speaking about a world in which a nuclear war has happened. So at this point, I think it's more effective to talk about this recession. How does it interact with the other arguments in the round? Particularly, how does it take out the affirmatives arguments in the round, the affirmative solvency and so on, rather than reading impacts to it, because I don't think you're going to try to outweigh with the intergenerational poverty thing. I don't think that's what the final focus is going to be about.
Third of all, they say that they have probability, but no, we say that probability doesn't matter because the recession happens on day one. Investors flee the moment they see that Medicare for all passes and their stocks don't matter. But now let's go to our...
That doesn't mean probability doesn't matter. It means probability does matter, but you are probable. And that your time frame also happens quicker, right? So I wouldn't necessarily go with the framing of probability doesn't matter. It's that they say their argument's probable, but ours is more probable. Or they say we're not probable, but we disagree because it happens on day one. Right.
Wayne, we are outweighed for three reasons. The first is time frame. Like I just said, investors flee on day one because they realize that the stocks don't matter anymore. The reason why this matters to the round is because of intervening actors.
But time frame of what? When you're weighing, you need to be weighing something against something, right? To say, like, let's do some weighing for us. We're going to be winning on time frame. It's kind of like saying, in a competition of wealth between me and Paul, I'm winning because I have 7. Like, 7 of what? Right? Like, the impact weighing mechanisms measure the weight of a specific impact, right? So let's take a look at that again.
We are outweighed for three reasons. The first is time frame. Like I just said, investors flee on day one because they realize that the stocks don't matter anymore.
So what you're doing here isn't impact comparison. It's not like weighing. It's link comparison. You're trying to determine which of these links is more likely to happen, right? But weighing would be saying, okay, let's assume both of these things happen, which is more important. Here you're saying, I mean, I guess you can call it weighing, sure, but here really what you're doing is you're talking about why your recession scenario is you're going to win that argument. That's fine, but you still need to then weigh the impacts of winning that argument, right?
Why this matters to the round is because of intervening actors. Intervening actors means that there's so many other things that could prevent pandemics from happening, or cause them to happen in the first place, like pandemic or like social distancing or hospital beds. But there's literally nothing that we can do to prevent.
What are we talking about? Preventing or causing?
Intervening actors. Intervening actors means that there's so many other things that could prevent pandemics from happening, or cause them to happen in the first place, like pandemic or like social distancing or hospital beds.
You say preventing and then correct yourself into saying causing, but then you're talking about hospital beds and social distancing, which I don't think cause pandemics.
But there's literally nothing that we can do to prevent the stock market from collapsing because investors, according to the Ableton evidence, will literally leave right away. That is the most important impact in the round because intervening actors controls the link to all the rest of the weighing. Because if you don't have intervening actors, that means that you should be looking to our weighing first. But then the second piece of weighing is the prereq that they also dropped. They dropped the Bozzoli evidence that indicates that during recessions, hospitals close down more and they have to restrict access. The reason why this is important is because in order to have a link into their case, they need to be able to detect the cases in hospitals in the first place. We're seeing that those hospitals don't exist. We prereq their argument. And third of all,
so are you going for prevention or that it's non-unique? Like, just go for the non-unique. You don't have solvency. The pandemic's going to happen either way. Right, or the turn that you cause more and worse pandemics to happen because you collapse the healthcare system or cause wait times or all of the other stuff, right? Right, like pick one, right? It's late enough in the debate that you should pick, and you should tell me which scenario happens. I think it's too late in the debate to be like, this is going to happen or this is going to happen, because you're asking me to make choices. And when I make choices, you're inviting chaos, not just because I'm a psychopath, because that's what happens with judges. You want to give judges a direct narrative, a direct scenario. And I'm not talking about like narrative and like, oh, this is a narrative building debate. What I mean is you need to say like, what matters is, do you believe X? Do you buy this argument? Because we have won. If you buy X, that X leads to Y, Y leads to Z, Z leads to, I don't know, alpha, and that is the biggest impact in today's debate. But what's happening here is, what they're saying is, X is one argument that you could vote for. And here's, maybe you could go this way, or maybe you could go this other way. Or you could look at Y. Y is just as good as X, but also it's not. And it could go this other way or this other way. We don't know. And it doesn't create good, consistent results. You end up being at the mercy of chance and who your panel happens to be. Whereas I think collapsing to an argument and saying this is the scenario that they have conceded will happen, and that scenario means you vote for us, I think the collapse method is much more effective. I also wonder to what degree because his partner went pretty hard for the pandemics happen a lot argument, and then it sounded like he was saying pandemics were preventable, and now he's saying, but actually you don't even prevent them, so even if they are preventable, you don't prevent them, and it's messy, and I think it makes the job of the final focus a lot more difficult. Makes it difficult for us to focus on the issues that matter.
We say that we short-circuit their argument because of social distancing. We say that during recessions, because of the culture of the American economy, people tend to just go out and go to their jobs because they're out of desperation during a recession. That's exactly what happened during the COVID pandemic, which means that we ultimately are going to be short-circuiting because of a recession. With that, let's go to their case. Three major responses here. First of all, they say that management doesn't matter and that Trump is going to leave office soon. That's not the argument. The argument is that the culture of the American people is that they care more about recessions. So recession always comes first. Then on the Norquist turn, two things here. First of all, we say that hospital beds are going to be restricted under Medicare for all because you have to consolidate the system so much, which means that you can't even detect it in the first place. Then second of all, they don't address the turn. What we say is that there's loose regulation, which is causing innovation in the status quo. And that means that A, we can solve for the COVID pandemic right now, but B, you can have the vaccine. That's important because it turns their argument because we actually have solvency. Now go to our case. They extend this one response about diversification on our second contention. That's not true. Their evidence is literally terrible. Our argument is much better on this question because we say through the Ableton evidence that investors are going to be fleeing on day one. They're not ready to diversify on day one because the stocks would be literally worthless. At that point, extend case. Wolf explains that the economy is rebounding right now, but White explains that a next shot would push us into depression. However, the Ableton evidence is that the investors are going to leave immediately, and Epstein says that trillions would be drained from the economy, which ultimately leads to Bradford saying that 900 million people would go into poverty because the healthcare sector collapses. So the weighing on the
I think that the negative has a pretty clear access in my book to the argument that making privatized healthcare public makes the stocks of those private healthcare providers, if not worthless, a lot less valuable. And I don't buy the argument that companies can diversify faster than the economy can crash. I don't know what that does in the debate yet because the macro level impact comparisons haven't come out yet. Hopefully they will in Final Focus. But if I'm flowing, I am at this point deciding I am willing to buy econ goes in favor of the negative because I don't think the diversification or that we save money on healthcare or whatever prevents or overshadows the economic effects of a stock market panic. I don't think that any of the answers have been sufficient to make me believe that that panic doesn't happen.
that is done. Now, quickly on our contention one, they talk about this turnabout taxes, about the economy. They don't get access to this because the recession happens before that happens. And the reason why the recession matters is because their economic growth doesn't matter insofar as people don't spend during recessions. They save their money, which means that they don't get access to economic growth, which means that they can't solve for the recession. The recession is going to come first because of time frame, which frames the rest of the round. Vote neg.
We'll run
So I think that speech would have benefited from an overview. And I'm certainly not the best at giving an overview, but my overview of that speech would have sounded something like, let me pause this so I can focus. It would have sounded something like this. Judge, ultimately, this round is a question of sequencing. All of the impacts that we're talking about happening interact with each other in some way, which means that in order to predict what the outcome is going to be, it's really important for us to identify which argument is going to happen first. We are going to win the argument that our economic collapse argument happens first because it is predicated on, I think is going to happen first. That's enough. But if I had to explain why later, it'd be because it's predicated on a stock market panic that they have no answer to, even if the companies can make themselves valuable. That does not prevent investors from leaving, which then drives down the price of the stock and gets everyone to try to sell the stock they own to minimize their losses, which then creates a collapse in the entire healthcare industry, which is 20% of the United States stock market or GDP or whatever the argument was, right? I think that is the pretty clean argument to establish up top, and then everything else should be in the instance of that happening. I'm not phrasing that right, but should be, in the wake of that argument. Doesn't matter, but should function under that presumption.
30 more. So I think we got like 45 left. All right. Are you guys ready for cross?
Yep.
Okay. During a recession, does unemployment go up or down?
Up.
Okay. So your third argument that like during recessions, pandemics get worse because they go to work more. How does that make sense? If unemployment goes up, they would go to work less.
Yeah, but you like the people who are employed go to work so that they don't become unemployed. That's the argument.
Yeah, people go to their jobs in a functioning economy as well.
They go home to social distance. That's what happened with the COVID
People
pandemic
go
too.
to work.
Like once the economy
Yeah,
started doing
this is
so
fine.
bad, people started to say, you know what, it's okay. Like I might as well sacrifice the small probability that I get COVID to me literally having a livelihood.
Also,
That's like
That's literally okay. Your argument isn't true. Like people go
That's
to
not a
work in
question.
functioning economies as well. Like there's no evidence that people like
Not when
increase
they're
their
sick.
work hours or whatever.
But
People
that's not the
decrease their work hours because less people had jobs. Like
But
millions less people had jobs.
That's not the argument. The argument is that during pandemics, when you're required to social distance, people are more likely to go to their jobs during a recession because they want to have livelihoods intact.
They don't have a job though. They can't be more likely to go to their job if they don't have a
Okay,
job.
that's fine.
Some people
Gus,
won't have jobs, but they'll
Gus,
still go to like
the
the
US
US.
Like millions of people, like 40% of the U.S. population didn't have a job during coronavirus.
Okay. I would say that if 60% of people are still going to their job, that's enough to spread the
That's
virus.
non-unique because they go to their job no matter what.
Also non-responsive to the other part of the weighing is that we open up the economy during recessions,
Okay.
which is during like a recession and a pandemic at the same time.
Okay.
Question.
First, yeah, that's fine.
Okay. So let's talk about your solvency. You read just Williams that says Taiwan solved better, right?
Yeah.
So what policies other than single payer did Taiwan implement?
I don't know. Do you want to tell me?
Yeah, so they imposed it's around equal to $1,000 if you were caught outside of your house.
Okay. So when
It's
was
obviously a different
first?
thing.
Can you explain to me when you said this before Grand Crossfire?
I mean, I would just say your argument doesn't make sense for the
It's
US
to-
Taiwan example.
It's to prove that the recession is inevitable.
Okay. Again. When was this argument made before
No,
Grand Crossfire? Like I understand
The
what the
argument was
implications
made
of it are. I
that
just
there
want to know
are
when it was said.
other
It's
policies.
an explanation of the culture response that we say that it's a matter of the U.S. taking we knew that it was going to happen. It's a matter of the American people
Again,
reacting to it different. Yes,
our argument,
home,
this argument,
the US didn't.
this argument doesn't apply. We responded. First, Trump, like, is it possible to predict who's going to be in office? The second thing is that Trump is only opposed to nationwide lockdowns because, like, they hurt the economy. Our argument is that we do more targeted lockdowns so that the nationwide economy doesn't have to be shut down in the first place.
So you just said that. Okay, that's fine. You can get a question.
Okay. So you
These
say
questions don't
you say that like
matter.
hospitals
They're not
close because there's a
linking to
recession,
the
right?
biggest
So in order for the recession to happen, the pandemic has to get really bad, right?
No.
Wait,
The
what?
recession is a link from our contention to about stock market, which happens on day one, and you never responded.
Okay.
Yeah,
That's fine. We'll run our remaining 45.
Ready? Okay. It's going to be the AF, then the weighing, then the neg. Okay. Extend pandemics. The Heidi evidence finds the factory farms are the perfect place for pandemics to spread. The WHO literally says that a pandemic coming from these factory farms is inevitable. And the Zimmer evidence finds that Medicare for All tracking and centralization through better systems will identify pandemics before they can break out and go global. And the Williams evidence finds that Taiwan implemented these systems and has only had 7 coronavirus deaths. We can stop pandemics through centralization. And the Paramo evidence finds that each pandemic that happens in the United States without centralization will pull 100 million people into poverty. Let's go to the weighing. First, extend our time frame weighing. Pandemics will continue to happen and trigger recessions continuously until we solve. Their recession only happens a single time and does.
I think the argument that Medicare for All prevents pandemics forever is pretty unsubstantiated. I'm not flowing, so I can't promise you that the negative had a good answer to it on the flow, but I'm not inclined to buy it. And in the scenario where I don't buy it, it doesn't matter if the pandemic happens. It's not the point isn't factory farms. You don't need the factory farms link into a pandemic happening, because the negative is also talking about pandemics happening. What you want is to have solvency for it, which is predicated on Medicare for All solving for all global pandemics, because it being centralized means that they better track where things are happening. I think that is just really far-fetched. And I can't tell you whether none of these judges are going to go for it, but yeah, I think that's the argument you're really making.
Not trigger and like does not continue on indefinitely like the pandemics recessions were. All they say is that pandemics will exist either way. That's like saying corona doesn't matter because HIV exists. For every pandemic you stop a massive recession. Then they say that recessions have long-term impacts. We link into recession. Then they say that
the point isn't that they would exist either way, so let's not do anything. It's pandemics would be caused either way. So it's like there is, I won't get totally derailed by this, but there is a method that has a really high probability of being a cure for AIDS, but it involves the patient being put in a medical scenario that has a 50% mortality rate, which is way more dangerous than AIDS. So in that scenario, it's like, it's not about like, oh, like death is going to exist either way, so let's not try to help people that have HIV. It's this method is more or just as likely to like cause death as the thing we're trying to treat. So let's not choose that method.
there's also extend our probability analysis. Our evidence says that it's literally inevitable. However, all they say is that their recession happens on day one. It doesn't matter when it happens. No socialized country has gone into a recession after implementing UHC. It's super improbable. They say intervening actors, there's nothing to stop a crash. The government does bailouts and fiscal and monetary policies to save the economy.
That argument was new. No country has gone into recession after implementing universal health care because of a stock market crash is new.
All they say is that their recession happens on day one. It doesn't matter when it happens. No socialized country has gone into a recession after implementing UHC. It's super improbable. They say intervening actors, there's nothing to stop a crash. The government does bailouts and fiscal and monetary policies to save the economy. That's how 08 happens. On the prereq weighing, they say that like it hurts hospitals. That recession only happens once, and also the link isn't hospitals, it's testing. Then they say more people will go to work. That's very low solvency, and also people go to work less in a recession. On their responses, they say that management is the problem. They drop Gus's responses. First, we'd have no idea who the president will be. And second, it's not about a full lockdown. Public health officials are the ones who have control over finding hotspots. It's very small scale at first, which is why the federal government doesn't care about these small scale.
It's just all predicated on the idea that if you find hotspots, something can be done about it. But that's just not substantiated in any way by the affirmative here.
Projects. And on Norquist, they're saying that they're better at stopping the pandemic after it's happened, but it's not about it, but we are to stop the pandemic before it happens, which means that their solvency only happens after millions have died. On their side, Silverstein finds that healthcare companies will diversify to international markets and health IT, and they just say that investors flee on day one. However, investors won't flee because they know that the company values will increase in the long term. Their recession is short term.
Your like last three sentences were over time, right? Like,
it might have been the lag, but like that's what I had.
It was like 7 seconds over, yeah.
Okay. We'll just go. Just say you extended Silverstein then. Is that fine?
Yeah.
Okay. Wang, and then go to our Wang. Quickly respond to their Wang, and then our case, their case, I think. Yeah. Does that work for everyone? They have conceded the meta-weighing debate that comes from Arjun's summary. We explain that time frame controls the rest of the weighing debate because our argument is that on day one, right after Medicare for All gets passed, our impacts happen. You have no idea when this pandemic ever hits. You have no idea when all these growth impacts hit. You know for a fact on day one, right after Medicare for All passes, the stock market crashes and we go into recession, which means that you have to look to our weighing arguments first because they happen first and you have no idea when their impacts happen. Let's go to our weighing. The first argument that we make and extend through the round is the Bozzoli evidence that explain that hospitals close down during recession because they no longer have enough money. They respond first in first final focus. Number one, it's too late. But number two, our argument is that hospitals permanently close down. This short circuits their pandemics argument because you have to go to the hospital to get tested for pandemics, which means that if we go into recession on day one, right after, you can't solve back for the pandemic that's inevitably going to come. But number two, they drop the recession makes pandemics worse argument because we say when the economy is going down, people feel like they need to continue to work and make that money back so they don't go into poverty, which is why during a recession, the pandemics get far worse because they go to work. At that point, go to extensions. Their only response is essentially that companies are going to diversify. They never respond to the Abelson evidence that explains that you're taking out 20% of the GDP. The rest of it's conceded. The White evidence explains that the economy is recovering in the status quo, but another shock would push into a depression. The Abelson evidence explains that when you abolish private health insurance through Medicare for All, you would collapse the entire stock market in order to take out 20% of the GDP, which pushes 900 million people into poverty. I already did the weighing on the recession. Go to their case. On their pandemics argument, there's two big problems here. Number one, our argument is about the American people, not whether the president is bad. Our argument is that the American people don't believe in the social distancing, which is why people in like other states, for example, like in Alabama and these other red states, are still not social distancing, even if Trump did say so. But second, our argument from the Norquist evidence is not responded to until first final focus is way too late. Our argument is that loose regulations on innovation allows, number one, to solve back for the COVID pandemic the best, but number two, solve back for future pandemics. Even if they solve for one pandemic, we solve for all future impacts on pandemics, which means that we are the best solvency on pandemics on magnitude and time frame.
Good round.
Good round.
Sorry, I'm having like pretty bad lag issues, but hopefully I'll be able to just get through this without. There it is. Okay. Some thoughts on that debate. We recently, yesterday for me, recorded a video with Jack Johnson, who was a very successful TOC competitor in public forum. And that video will come out soon. I don't know, Monday, Tuesday. And one of the questions that we asked Jack was, in your time coaching rather than being a competitor, like in the last year or so, just focusing on coaching, what is some way that your view on debate or your strategy around debate has changed? And Jack's answer was that he's recognized the importance of making each of your arguments. He said that basically if they had 3 arguments or if they had 2 arguments, 2 contentions, there was one contention, one argument that they would collapse to 80% of the time. And he now sees the value in making every argument in your case a viable area to collapse to, where if this argument's working well for you on the flow, you can win the debate. You don't have to go for these arguments. And I think that's what's going on here. This debate ends very differently than how it starts. And as I'm watching the constructives, I'm like, why is this a round that got recommended to me? And the fact of the matter is that the round gets good. It becomes a good round, but that is only able to happen once the debaters are left arguing the positions that they were prepared to argue anyway. Meaning, like, the negative could have won on nuclear extinction, but that argument was probably what they were used to, is they say it, then the opponents take a bunch of time to respond to it, and then they just go for the argument instead. And, the affirmative ran 4 contentions. We really only heard about 1. Right? Like, we didn't even really hear about preventative The preventative care one got mentioned once in summary, but it didn't really play a large role in the round. We're certainly not getting that weighed against anything, right? Like, look, at the end of the day, we know that people can get preventative care, and that's all that matters. Like, it's just, it didn't matter at the end of the round. So that's the first thing that stands out to me about this round. I think, given the round that the debaters ended up with, starting with, like, basically the debate that came out of the rebuttals, it was a strong round, and the debaters are very skilled, and they did good things. I think the areas for improvement are the cases that they created, that they set up the debate with, and how the rebuttals carried those cases forward or challenged those cases. But I feel like once that part was done, the debate was pretty decent. And I think it's probably because that's a debate that both sides were more used to having. They were more experienced with that kind of clash. They were not as experienced going for the other arguments in the round, which is why when you're practicing, and this is something that we talked about in our discussion videos way back, I think one of our earliest discussion videos is how to improve when you're the best person on your team or in your area. And given that you're the octos of a really tough tournament, I would imagine that you're probably the best debaters on your team, and likely one of the best debaters in your area. And that's great, but it hinders you because you have an argument and you can win on it anytime you try to win on it in practice. You have an argument and you can win on it anytime you try to win on that argument against the average team in a prelim, right? But there are instances where that argument becomes harder or at least less optimal to win on, and you need to go for another argument, but you can't do that under pressure because you don't have experience doing it. You haven't been practicing it. And the solution to that is when you're practicing against your teammates. When you're practicing or when you're in a round against weaker opponents, you have to challenge yourself and say, this round we're going to try to win on this argument. We're going to try to win on the Afghanistan argument. We're going to try to win on the... I don't even remember what the AF second contention was, but we're going to try to win on that. You have to make each of those cases viable, and then you would see a very different round stem from how we saw this round start. That's my first thought. My second thought on this round is that there's a lot of what they call meta weighing, which, again, I'm not exactly sure what that is intended to mean in this context because I don't really have a discuss debate in this public forum community and go to the camps and know what they mean when they say meta weighing. Here's my understanding of it. There isn't impact comparison happening here. In other words, no one is saying, yes, your link happens and it generates an impact, but my impact is more significant than your impact in a scenario where they're both happening. Instead, they have like link takeouts and root cause arguments and, well, and it's really sequencing arguments, right? It's like my impact is sequenced before your impact, which is fine. That's a pretty good debate to have. And for a sequencing debate, like, they do a good job of it. But I think there's still the impact weighing missing. I think that would improve both teams. lastly, I think there isn't enough of a collapse. Even though they're going for the contention that they were always going to go for, they're not confident enough to be like, this is the scenario I'm going for. Either they're not confident enough or they're not identifying it before their speech starts, and when they start their speech, they're just throwing everything they can think of out there. Collapsing is a scary thing because the only way to learn to collapse well is to commit to collapsing to the wrong thing many times. And no one wants to do that. It feels like a backward step. So let's say you, right now you're going to a tournament, 6 prelims, and you are going 3-3, right? Maybe 4-2. Let's say you're going 4-2. And someone says, hey, you need to learn to collapse better if you want to get to that 5-1, 6-0 area. So you start collapsing, and then your next tournament you go 3-3. And the round you lose, they say, if you had collapsed to the other, you were winning, you made the right argument, but you didn't extend this thing. You collapsed incorrectly. Or they don't even know what collapse is, and they're saying, like, you didn't mention this thing, and I would have voted for you, but you didn't mention it, so I didn't vote for you. People are really scared of that happening, and sometimes it does happen, and that signals to them that I shouldn't do that again. That I shouldn't collapse because we collapsed to the wrong thing. Maybe instead of 3-3, you go 2-4, but the thing is, if you keep with it and get good at collapsing, that makes your round vision skyrocket, but that also finally unlocks that 5-1, 6-0 range. And I'm using that record arbitrarily. For all I know, one of these teams was 5-1 or 6-0. But what I mean is it takes you to that next level of being able to debate well. And you have to accept that it's going to worsen your performance for a little bit while you're learning it. But then when it clicks, you'll be better off for it. I think both sides were really good. If I had to predict which side won, I would predict that it was a negative ballot. A 3-0 wouldn't surprise me by any means, but I think just with kind of that lack of collapse, right? I don't mean just collapsing to one issue, right? I mean collapsing to one scenario for how that issue happens, and not just in the final focus, but early enough so that your opponent seems unresponsive to it rather than just you got to speak last. I can see because of that it going 2-1, but ultimately I feel like it was a 3-0 affirmative ballot would certainly surprise me. A 1-2 wouldn't surprise me again because it's messy. But if I have to put some money on this, I'm going to guess it's a 2-1 for the negative. Let's find out. Is it less laggy when I do this because the video is smaller? I don't know. The affirmative picked up on a 2-1. Okay. I mean, I think the negative certainly had clean access to that on the flow. Access to the win on the flow, but again, like, they made the debate messy. And messy debates are really impressive to people who... It's like in the TV shows when you're watching, like, NCIS or something. And they're, like, hacking into somewhere. And there's, like, all this stuff and it's, like, going on and whatever. And it's really impressive to somebody who isn't at that level. But... you know, even if that's what hacking looked like, efficacy is probably a concern for a good hacker, right? Even if that's what the user interface or whatever looked like. Like, having a million things pop up and typing a lot and scrambling and being panicked, like, is impressive to somebody that can't do that. But, isn't as impressive to somebody who could do that but doesn't need to. I hope this video is watchable because there's a lot of lag right now. But I hope something I said has been useful. Take care.